Hello, this week we'll talk about behavior therapy. I added an explanation to Meta class. Actually, behavioral therapy, cognitive behavioral therapy, reality therapy, and rational emotive behavior therapy are considered under the umbrella term of cognitive behavioral therapies. But by its nature, behavior therapy a bit differentiates from other therapy and theory approaches. Therefore, I will mention behavior therapy this week separately, and the week after this week we'll cover cognitive behavioral therapy, reality therapy, and rational emotive behavior therapy all together. Now let's talk with basic assumptions of behavior therapy. I think all of you are very familiar with behavioral therapy, but I will briefly mention about these. Actually, I think you already know that behavioral therapy is a really dramatic, radical departure from psychoanalytic perspective. It arises with criticism to psychodynamic approaches. And they differ from other therapeutic approaches because it applies principles of learning. You already took the course of psychology of learning, so actually behavior therapy is based on the principles of psychology of learning. So you will see lots of operant conditioning, classical conditioning, reinforcements, punishments, etc. And traditional behavior therapy mainly is based on classical conditioning and operant conditioning. You already know about this from psychology of learning class. And attention is given to emotions, biological factors, as well as behaviors in psychological disorders. The most accepted and valued part of behavior therapy is that since everything is very systematic in the approach, treatment goals are specific and measurable. Remember that for experiential therapies and for psychodynamic approaches, it was difficult to measure treatment goals and if the goals were achieved by the clients by scientific measures. This behavior therapy brings this empirical evidences actually. So one of its basic strength is this specificity and measurability, and they focus on the client's current problems, and the basic aim is to help people change their maladaptive behaviors to the adaptive ones. This therapy can be considered as educational because it aims to teach clients skills of self-management. So in its nature, there is the focus of educating the clients. So as a result of this significant position, the view of human nature rests on a deterministic assumption that humans are a mere product of sociocultural conditioning. However, with the influence of social learning theory, developed by Bandura, cognition becomes a legitimate focus for behavior therapy as well. And to deepen our knowledge on the view of human nature, the behaviorists state that person is the producer and the product of his or her environment. According to this perspective, there is still the individual freedom of clients and they are capable of increasing their skills. So the aim is to increase people's skills so that they have more options to respond, and this increases individual freedom. Now you may think that if behaviorism can fit into existential or experiential oriented approaches where the freedom of choice, where taking responsibility for actions is considered, actually behaviorism is not existential in its nature. But they say that if people want to change something, they can do it by applying some behavioral techniques. They can achieve. But while you're talking about the concepts in existential or experiential oriented relationship based approaches, we are mostly after increasing our self-awareness in order to be um, free and to take responsibilities for our choices. And there, in those experiential approaches, mm, client is viewed to be strong enough, resourceful enough to take action on his or her own. But here, behaviorist approach is deterministic, and since its nature is basically educational, you will see that behavioral therapists will display a more directive orientation towards their clients. So these um, individual freedom concepts are different between these therapy approaches, okay? But if you still have questions, please write below. Okay, this is an action-oriented approach, and clients are being asked to act rather than to reflect passively and examine their problems. You see that we are not after increasing our client self-awareness. We are not after discovering, exploring deeper orientations. Just we are concentrating on actions in this approach, and clients are taking help to take specific actions to change their lives. They are very concrete steps to take, okay, to change something in your life. Okay, this view says that the person should carry the responsibility for own behavior, and given the techniques and skills of self-change, people have the capacity to improve their lives. Thus, people are in the form of taking the responsibility of their behavior. Yes, they are at this capability, but with the help of an outsider, an outside controller, okay, the therapist, I mean. So they are expected to translate what they learn to their everyday life. And there are four aspects of behavior therapy where they take their basis. Firstly, classical conditioning. You already know about it. A natural stimulus is repeated paired with a stimulus that naturally elicits a particular response. The result is that eventually the neutral stimulus alone elicits the response. And in operant conditioning, it focuses on actions that operate on the environment to produce consequences. If the environmental change brought about by the behavior is reinforcing, the chances are strengthened that the behavior will occur again. If the environmental changes produce no reinforcement, the chances are lessened that the behavior will recur. We are after decreasing or increasing the behaviors we want to occur in life, okay, in operant conditioning. And the other two aspects of behavior therapy is social learning approach and cognitive behavior therapy. In social learning approach, it gives prominence to the reciprocal interactions between an individual's behavior and the environment. The environment is important, and it has a role in people's learning and taking actions. And in terms of cognitive behavior therapy, it emphasizes cognitive processes and private events such as client self-talk, which we will cover next week, as mediators of behavior change. Actually, behavior therapy sets the stage for the aforementioned three cognitive behavior approaches, okay? Because everything has started with behavioral approaches, and afterwards the other remaining cognitive behavioral therapy, reality and rational emotive behavior therapy has extended behavior therapy and added the impact of cognition and emotions in terms of altering behaviors in one's life. So this sets the basis for these remaining theories. In behavior therapy, therapists should be active and directive, and he or she is considered as a problem solver, and therapists conduct a thorough functional assessment. They formulate initial treatment goals, they use strategies for behavior change, they evaluate the success of the change, and conduct a follow-up assessment. Here you see they state that, of course, the client is responsible to take action to conduct these behavioral plans after the sessions and to take responsibility for the things they acted through or not. But here the direction comes from the therapist, okay? So in this regard, it differentiates from existential and experiential approaches. From the beginning, actually, behavior therapist leads the process, okay? And role modeling is important in behavior therapy, and this refers to mostly learning by observation. And this was especially mentioned in Bandura's theory. The therapist as a person becomes a significant model in this regard in the therapy sessions, right? So it is essential that the therapist be aware of the crucial role they play in the therapeutic process. For example, if you're a client, I'm talking from the perspective of behavior therapy. If you're a client who has gone with a weight problem, with an overweight problem to a counselor, but if you as a counselor are overweighted, there will be some discrepancy because you will not be able to model your clients. Okay, this is important. In other approaches, we don't really mention these things, or think that your client comes to you to to quit smoking, but your client sees you outside smoking. Okay, these are important since learning by observation takes a crucial role in learning and changing. And what client experiences in therapy is that the client is taught concrete skills. All of these skills and all of the steps are planned ahead and they are very concrete. And they are to be motivated to change, they are to enlarge the options for adaptive behaviors, they are to continue implementing new behaviors. Arkadaşlar, davranışçı perspektif özünde herhangi bir hayatınızda sorun olan herhangi bir davranışı değiştirmek üzerine kurulu çok temel bir kuram aslında. Bunun için de ne yapıyorsunuz? İşte verimli ders çalışma diyelim ki. Verimli ders çalışmada sorunlar yaşıyorsunuz ve zaman yönetiminizde zorluğunuz var. Bir behavioral terapiste gittiğinizde size önce zaten bir functional assessment yapacak. Hani nerede nasıl zorlanıyorsunuz ve sizi durduran şey tam olarak nedir diye belirledikten sonra mesela günün en çok hangi saatinde zorlanıyorsunuz? Ne yaparken? Öncesinde bu zorluğu yaşamadan önce tam olarak ne oldu? Ve hani işte çalışamadıktan tam sonra ne oldu? Gibi böyle çok measurable, concrete bilgiler alınır behavior terapide. Sonra da bunların değişimine yönelik adımlar atarsınız. Bir haftalık mesela size danışmanınız bir chart hazırlar. Böyle bir haftalık doldurulacak haftalık çizelge hazırlar. İşte bugün her güne de birer ödeviniz olur. Ödev de çok sıklıkla kullanılır. Atıyorum pazartesi günü 15 dakika hiçbir şekilde masadan kalkmadan, telefonunuzla oynamadan 15 dakika boyunca 10 tane test sorusu çözmeniz. İkinci günde böyle, üçüncü günde böyle, dördüncü gün işte 20 dakika bunu yapmak ve her yaptığınızda o chart'a tik atıyorsunuz ve danışmanınıza götürüyorsunuz. Her şey bu kadar ölçülebilir, net ve somut. Sonra seansta yapabildikleriniz, yapamadıklarınız üzerine konuşuyorsunuz. Ama işte tam da bu noktada bunları yapabilmek ve aksiyona geçip, harekete geçip, bunları gerçekleştirip seansa taşımak sizin sorumluluğunuzda oluyor. Bunların akabininde de ya terapist size belirli ödüller, pekiştireçler veriyor ya da kendinizi bu noktada ödüllendirmenizi, pekiştireç vermenizi, belki negatif punishment, pozitif punishment, belki pozitif reinforcer, işte ne bileyim negatif reinforcers kullanmanızı istiyor. Bu teknikler birlikte belirleniyor. When we focus on the relationship between therapist and the client, of course, the therapeutic relationship is expected to be warm, to involve empathy and acceptance. These are necessary but not sufficient for behavior change to occur, as it is, for example, in person-centered approach. And therapeutic relationship, of course, contributes significantly to the process of behavior change. And if client has some positive expectations and hope for change in the future, these contribute to the successful outcomes. But Believing the progress is due to the specific behavioral techniques instead of therapeutic relationship. Remember that in experiential approaches, the therapeutic relationship itself was curing in its essence. But here, of course, there should be a therapeutic relationship, but the behavioral techniques used are more important than those therapeutic relationship most of the time. And to consider the therapeutic techniques and procedures used in behavior therapy, you already know operant conditioning techniques. These are positive reinforcement, negative reinforcement, extinction, positive punishment, and negative punishment. You know that in positive reinforcement and negative reinforcement, we are after increasing the behavior that we want to recur again. Okay? So, in order to reinforce a situation, in order to increase the probability of occurrence of a wanted behavior, we add something positive to the environment. Or we give a token, we give a smiley face to a person, we give something meaningful to that human being in order to increase the behavior that is wanted. And in negative reinforcement, you already know that in order to increase the behaviors that we want, we either stop or reduce negative stimuli in the environment. And by extinction, we refer to the gradual weakening of a conditioned response that results in the behavior decreasing or disappearing, and as a result the conditioned response eventually stops. Okay, it disappears. And while talking about positive punishment and negative punishment, remember from psychology of learning class, when we are talking about positive punishment, we add something into the environment that will result in an unpleasant consequence, unpleasant response. And again, as a result, unwanted behavior will not happen in the future again. While talking about negative punishment, we are taking something good from the environment, something good, something pleasant away to reduce the recurrence of an unwanted behavior. Okay, and afterwards, the functional assessment model we have in order to assess the behavior ahead before systematically trying to change the behavior. I added a hyperlink here. There was a good example conducted at a school, an example of a functional assessment model. Here, let's say you are having a problem with conducting a behavior, or you want to change something in your life. Here, the therapist assesses what prevents you to take action for this. So because after these functional assessments I had mentioned before in the previous slide or slides, you are eager to take action easily in the following steps. Okay, so here the nature of the behavioral problem, what prevents the wanted behavior to actualize itself, is tried to be explored actually. Then also we have relaxation training. Actually, you know, relaxation training, systematic desensitization, modeling, etc. from psychology of learning course. If you still have any problems remembering them, or if there are points that you don't feel yourself competent enough in these issues, please write to the comments part, so I will answer all of you, or maybe in our synchronous class I will answer all of you in the class. But let me know that there is a problem with that topic. When we are talking about relaxation training, for example, focusing on our breath, or systematic relaxation technique, or progressive relaxation technique. For example, when you feel yourself too much tense, this is a technique. For example, you push your hands hard and you stay here for 10 seconds. Afterwards, maybe you harden your face and wait for 10 seconds. And afterwards, when you leave that hardness, then there will be a relaxation afterwards. This is progressive relaxation. Actually, we had practiced this in class as far as I remember last year. And systematic desensitization is used for anxiety and avoidance reactions. This is step by step. In order to conduct this, firstly, you should determine a situation where you feel yourself very anxious and where you feel yourself very stuck, let's say. A classical example is making a presentation in front of public, and your ideas are taken on this situation, and the points where you feel yourself most anxious are determined, and afterwards, step by step, you are exposed to these steps, and you are asked to decrease your anxiety level by level till the level of anxiety decreases to a minimum point that you want to achieve. And for modeling, we already talked about observational learning, especially Bandura mentioned on. And we have also exposure therapies. One of them is in vivo desensitization, and this is brief and graduated exposure to an actual fear situation or event. Flooding is prolonged and intensive in vivo or imaginal exposure to highly anxiety-evoking stimuli without the opportunity to avoid them. And EMDR is a very famous technique, and it's a very powerful technique we used in counseling, especially in last 10-20 years. And it's an exposure-based therapy that involves imaginal flooding, cognitive restructuring, and the use of rhythmic eye movements and other bilateral stimulation to treat traumatic stress disorders and fearful memories of clients. Mesela arkadaşlar, EMDR terapide bir protokol sorularınız var zaten. Karşınıza danışanınız oturuyor ve çalışmak istediği konuyu protokoldeki listede hangi kategoriye uyuyorsa onu seçiyor. Daha sonra biz böyle parmağımızı oynatarak danışanımızın parmağımızı bir o gözüyle, bu gözüyle takip etmesini istiyoruz. Tamam mı? Bilateral'lığı beynin her iki tarafında stimüle etmiş oluyoruz bu şekilde. Bunu yaptıktan sonra da seçtiği konuyla ilgili çalışabilmek için gözlerini kapattırıyoruz ve protokolde yer alan soruları sormaya başlıyoruz. Danışan bu sorulara yanıt verirken ve geçmişe dair ilk anılarına gitmeye başladıkça katarsis gelebiliyor, bastırma gelebiliyor, her neyse işte oradan malzemeler açığa çıkıyor. Bu da özellikle travmatik durumlarda özellikle ya da post-stress traumatic disorder'da PTSD ile çalışırken kullandığımız tekniklerden bir tanesi. And the other therapeutic techniques and procedures are assertion trainings, which under the umbrella of social skills training. This is to say yes and no to people where you have difficulties to say yes, where you have difficulty to say no maybe, and to be able to get in communication with other people, you can involve in assertion trainings, and there will be some social skills to be taught to you, okay, like active listening, how to talk, how to arrange your tone of voice, etc. And also self-management strategies, self-monitoring, self-reward, multimodal therapy, etc. These are all the techniques that we utilize in behavior therapy. Actually, this basic idea is important B refers to behavior, A refers to affective responses, S to sensations, I to images, C to cognitions, I to international relationships, and D to drug, biological functions, nutrition, and exercise. After behavior therapy took its basis on the psychology of learning, of course, it was extended beyond that, and basic idea involves behavior therapist extended version, not just focusing on the behaviors, but involves other dimensions of a human being as well. So, recent and more actual behavior therapists try to get an overview on this basic ID perspective to evaluate a person and to lead change in their behaviors. To summarize behavior therapy, it has some contributions. Most of them I had mentioned previously, but this is an empirically validated treatment, and behavior therapy is effective in terms of changing a specific behavior than other therapy approaches. It involves an educational process. Clients learn about the nature of therapy, the specific therapeutic procedures, and the benefits and risk of it, and decision of therapy goals, and the choice of techniques. So the clients are involved in this procedure, and it has some limitations as well. They are basically after changing the behaviors, not the feelings. They ignore relational factors except for learning from the environment, and they don't provide insights. They are not after providing self-awareness to people. They are just after changing the behavior directly. They treat the symptoms rather than causes. They are not after examining the symptoms of any behavioral problems, um, the causes of any behavioral problems, but every behavioral problems will have some symptoms, and they are treating those symptoms, and they are changing the symptom provoking behaviors. And I had said this before, the therapist has the control and the manipulation. Although they say that the client has independence in acting and taking the responsibility of their behaviors, main control and manipulation is on the therapist and his or her leading, and they have a directive role. So sometimes actually this may be understood in the sense that the client actually is not resourceful enough to make changes in their lives, as experiential approaches stated. I quickly mentioned behavior therapy. So, learning this approach is here in your responsibility. And I assume that both in theories of personality and both in psychology of learning and other courses, you have learned these behavioral principles. But please, please, please, if you feel that there lacks some information, if you feel that there is a point that you don't feel yourself competent enough to capture these key concepts of behavioral therapy, please write under the comments and I will be happy to answer all of them. Okay? Bye bye.